HIV human immunodeficiency virus is a virus. You may hear that someone is HIV infected, has HIV infection or has HIV disease. These are all terms and that mean the person has HIV in his or her body and can pass the virus to other people. HIV attacks the body's immune system. The immune system protects the body from infections and disease, but has no clear way to protect it from HIV. Without treatment, most people infected with HIV becomes less able to fight off the germs that we are exposed to every day.
Everyone is at risk, but especially at risk are those intravenous drug users because they share needles, or any people with sickness that requires a lot of intravenous drug or blood transfusion. They are at risk, but especially drug users because they share needles, and also sex workers and people related to them. Children, husbands and wives, especially. The person is HIV positive, there are no symptoms. They look like any abnormal people because the virus itself, the moment they're HIV positive, has not really attacked the person yet. The person will only develop symptoms when they have full-blown AIDS, if I'm not mistaken. And full-blown AIDS, one of the symptoms could be the scabs on the skin, cancer, pneumonia. If I'm not mistaken, pneumonia is one of the last stages of AIDS. So for a person to be infected just merely HIV positive, I don't think there needs to be. The only way to know for sure whether the person is HIV positive is to go to the test.
A person of any age, sex, race, ethnic group, religion, economic backgrounds or sexual orientation can get HIV. In 2003, there were an estimated 40 million persons living with HIV and AIDS worldwide. Of these, 37 million were adults and 2.5 million were underage 50. The overwhelming majority of people with HIV live in resource-poor countries. In 2011, 570,000 people more infected with HIV.
Who need to get tested for HIV? Only the high-risk group, people involved in the sex industry, intravenous drug users, probably people in the health industry because nurses and doctors coming into contact with patients who are wounded, handling patients with wounds. So they probably also need, I suppose, to take HIV every now and then. But mainly for drug users and also those in the sex industry. Children are not normally children are not intravenous drug users, so the only way children do get HIV virus is probably from their mother if they're breastfeeding, or possibly, I'm not too sure about this, physical contact with parents. I don't think they can get HIV from physical contact with parents, and children are normally not associated with sexual activity, so probably the only way for children to get HIV is from their infected mother's milk, or maybe coming into contact with body fluid, wound or something like that. But I don't think children will get HIV.
Immunization are important for all children. However, the schedule of immunization is different for children with HIV. So, it is important to tell the healthcare provider that the child has HIV. Also, vaccines given to an infant or child with HIV may become less effective over time as the child's immune system gets weaker. Foster care agency workers assess all children who enter foster care for their risk of HIV infection. If a child is thought to be at risk for HIV and is not able to make an informed decisions about testing, foster care staff gets assigned consent from appropriate guardian and make arrangement to have the child test for HIV. HIV is not like the flu or cold to get easily to human. It is not passed through casual contact or by being near a person who is infected. You can only get HIV if infected blood, semen, vaginal fluid, or breast milk gets into your body.
How long does a person can live with HIV? A person who is HIV positive can actually lead a normal life. Up to maybe more than 10 years, 20 years, if they do not develop AIDS. The problem is it's different for different people depending on their genes or their health condition. If they're healthier, they probably would survive longer without having catch AIDS once they're HIV positive. But it depends from person to person. For children, I'm not too sure, but I suppose it's similar to adults. They can still lead a normal, healthy life without catching AIDS, even though they're HIV positive for many, many years. Symptoms of HIV positive, there are no symptoms. They look like any other normal people because the virus itself, the moment they're HIV positive, has not really attacked the person yet. The person will only develop symptoms when they have full-blown AIDS, if I'm not mistaken. And full-blown AIDS, one of the symptoms could be scabs on the skin, cancer, pneumonia. If I'm not mistaken, pneumonia is one of the last stages of AIDS. So for a person to be infected, just think there needs symptoms. The only way to know for sure whether the person is HIV positive is to go to the test.
Children aged 18 months or older, both types of HIV antibody tests are more than 99% accurate in determining whether a person is infected. HIV antibody tests do not measure the amount of virus in the bloodstream. People involved in sex, drugs, health industry handling person with having and test for HIV, many for drugs and sex industry. It is especially important for women who are pregnant or considering pregnancy to be tested because women with HIV infection can pass HIV to their babies during pregnancy, delivery and breastfeeding. A pregnant woman who has HIV can take medicines that can lower the risk of a baby being born with HIV to less than 1 chance in 12. If the mother does not take this medicine, the baby has a 1 in 4 chance of being born with HIV.
Nucleic acid replication. For example, when AZT is incorporated into DNA by reverse transcriptase, no additional nucleotides can be added. A second class of drugs inhibits a protease involved in cleaving large polyproteins into functional segments. When the protease is inhibited, virus particles cannot be produced. Use of a combination of drugs directed at different targets reduces the likelihood of the development of resistance by mutation. Research is currently underway to develop new treatments for HIV. Chemicals called chemokines appear to inhibit HIV infection by binding to and blocking the CXCR4 and CCR5 coreceptors on host cells. A search is in progress to apply such chemicals in HIV treatment. Some individuals who are HIV positive but did not develop AIDS have a mutation in the CCR5 receptor that makes it defective. Research is in progress to determine whether disabling the CCR5 receptor might be effective in controlling AIDS in infected patients. An antiviral factor called CAF is found in CD8 cells. Research is in progress to determine if this substance could be used to block replication of HIV. There is currently no approved vaccine against HIV infection. One problem is that HIV surface proteins such as GP120 mutate at a high rate. Scientists may be able to construct a vaccine using an HIV with a defective form of the viral gene NEF. Viruses with the defective NEF gene seem to have reduced reproductive capability, allowing the immune system to keep the virus in check.
Okay, if you talk about effectiveness of the advertisement, the media, in the informing the public about HIV and also AIDS, I cannot tell you about the other countries, but for Malaysia, what I observe is not much. From what I observe from television, radio, and what I see around us, there has been a drastic reduce in the advertisements for HIV and AIDS. So, but compared to 10 years ago, more than 10 years ago, we see a lot more people being aware of HIV and AIDS, a lot more advertisements. But the younger generation today, for example, those in primary school and those in secondary school, will probably have lower, less knowledge of the dangers and the basic information of HIV and AIDS, because we don't see much of those advertisements anymore. I suppose the Malaysian government seems to focus more on this advertisement on those groups on the threatened list, the HIV users and these intravenous drug users and sex workers. But I remember I do see post HIV and AIDS posters in hospitals and clinics, but other than these places, no. So the media has sort of like toned down and slowed down on this HIV thing. Has it affected? I suppose, has it affected the situation? Awareness? Yes.
Treatment that fight HIV help people with HIV live longer, healthier lives. Often, it is best to start treatment before symptoms appear. A doctor can do blood tests to find out how much HIV is in a person's body and how much damage the virus has done to the immune system. This information helps people with HIV and their doctors decide when to start treatment and how well treatment is working. Earlier medical care helped people with HIV take best advantage of treatment for HIV. Many factors influence the decisions to begin taking HIV medicines, including cell count, viral load, symptoms, concern about side effects, and your ability to deal with them, and to take the medicines correctly.